Dr. Shetlin here, and I just want to review with you for a minute why you're going to a chiropractor or getting chiropractic care after an auto accident. It's really important to understand the reasons behind the care. And the research from the 50s to current show that chiropractic, massage, and physical therapy, the right modalities at the right time in your rehab, are hugely important in preventing long-term problems from occurring. See, after an accident, once you have an injury like a whiplash in the neck or the low back from a car accident, your body's laying down scar tissue for 12 to 18 months. And if we're not rehabbing those tissues properly during that time, rather than building healthy parallel fibers, we're going to build up crisscross scar tissue fibers. And what that does is it's not as functional as regular tissues, and it takes up more space, which the research shows by the 2-year mark, that's when people are stuck having chronic problems, or they thought the pain went away or the pain did go away, or they thought it went away for a little while, and then it slowly starts to creep back up, where by that 2nd year mark, they're like, man, it's really hard to check my lanes, or I'm noticing I'm having headaches again, or my neck's starting to hurt, or my low back's starting to hurt again. And now they're stuck with it because if they didn't finish rehabbing those tissues properly, didn't maximize their medical improvement in that time frame that was best, when the body's healing the best, early after an accident, that's when we end up with some problems. So it's important to, A, get the right care at the right time. And that includes chiropractic, where we're mobilizing joints, mobilizing discs, and flushing nutrients into those regularly. It also includes massage, where we're stretching and flushing the lactic acid and the muscle tissues themselves, and where the muscles attach to the bones, so that we're helping those tissues over a tensile forces to lay down more healthy parallel fiber and less of those crisscross scar tissue. Same with the physical therapy. Not early on, I mean, not while you're still hurting, but after we've got the pain under control, that's when it's important to start doing physical therapies that we're then exercising, and also through exercise challenging those tissues, those tendons where they attach to the bones, those ligaments and the discs, challenging those muscles to strengthen and rehab, and in some areas where the tendons have been injured or the ligaments have been injured, making those muscles do extra work to try to stabilize, especially in the spine surrounding the nervous system. So there is a method to the madness. And if we're not getting better from those initial things, those physical medicines, those 3 physical medicines that actually help rehab tissues, we don't want to just palliate symptoms with drugs. That's not helping us heal properly. That's just a short-term help with dealing with pain. But if we don't heal the tissues up properly, then we're going to have long-term or chronic pain. So we want to do these things right. We want to follow the right protocols and the research protocols that are out there. That's why the good physicians that deal in auto accident injuries use the Croft guidelines. The Croft guidelines are not a free pass for a number of visits. It's a educated estimate over time, 30 years of research, on depending on how severe that person's injuries are, how long it's probably going to take them and how frequently they're going to need to come in to get that maximum medical benefit. But if we're not seeing progress through the course of that care, then we need to implement more aggressive things, climbing the medical ladder, so to speak, to things like injections, trigger point injections, or nerve deadening injections, manipulation under anesthesia, or even surgery. Hopefully we can avoid those things, but those are the steps that we take. But we don't just jump from drugs to surgery. There's a whole lot of modalities and treatments that we can do in the interim. But the end game is to get you, the patient, who unfortunately was injured in a car accident, as healthy as possible again, as close to being pre-injury status as possible. And it takes following a recipe, a research-based recipe. And that's what we're going to do for you.